next developmental disturbance which we are going to study is dens invaginatus. It is also called dens indente or dilated composite odonto. Now, what is dens invaginatus? It is a developmental variation thought to arise as a result of an invagination in the surface of tooth crown before calcification has occurred. That means the crown has not been formed still, the calcification has not begun. During that procedure, if their invagination occurs, that will lead to dens indente or dens invaginatus. See, as the name suggests, invaginatus, which means invagination. So now let's see how does it occur. It can be due to increased localized external pressure. Increased pressure. Let's see how. Suppose this is a tooth germ, and due to external pressure there can be invagination. So let's see if this area the pressure is applied, what will happen? This area will deepen and there will be invagination. Next is focal growth retardation and focal growth stimulation. Now, at some points in the tooth germ, there is increased growth retardation, and at some points there is growth stimulation. So because of that retardation and stimulation at different sites, invagination can occur. Most frequently involved tooth in dens invaginatus is the maxillary lateral incisor. So the maxillary LI is the most frequently involved tooth. Now, in other words, how can we define dens invaginatus? We can say it is accentuation in the development of lingual pit. Now we all know on the lingual surfaces of the incisors there is a lingual pit. If that lingual pit accentuates, that means it becomes prominent and deepens. That will lead to development of dens invaginatus. Now here is a diagram which depicts dens invaginatus from the most mild form to the most severe form. Now in the mild form, let's see what is there. Pear-shaped invagination we can see. It's almost a pear-shaped invagination. There is a narrow constriction at the opening on the surface of the tooth. See here that it is a narrow opening. What is the complication? Caries and infection of pulp due to packing of food debris in this area can occur. So in this narrow opening there can be food impaction which can lead to caries, and further it can lead to infection. And in the most severe form, what we can see in this form, in the radiograph we'll see bizarre radiographic picture, and there will be severe disturbance in the normal anatomic and morphologic structure of teeth. So what is dens indente? It's simply the invagination of the tooth crown before calcification due to some external pressure, growth retardation or focal growth retardation, and focal growth stimulation. And dens invaginatus is simply an accentuation in the development of lingual pit. So we have already seen what is dens invaginatus. Now let's see the opposite of dens invaginatus, that is dens evaginatus. Now, how they are opposite of each other? First, in dens invaginatus, there is invagination of the crown, and in dens evaginatus, there is an extra growth of enamel. So now let's study what is dens evaginatus. A developmental condition that appears clinically as an accessory cusp or globule of enamel on occlusal surface between buccal and lingual cusps of premolars, unilaterally or bilaterally, although it has been reported to occur rarely on molars and cuspids. So now here they are saying that it appears as an accessory cusp or a globule of enamel on occlusal surface. First thing, it occurs on the occlusal surface and it appears as a globule or an accessory cusp. Second, where it is found? On between the buccal and the lingual cusps of premolars. So here we can see that these two are the premolars. This is the buccal cusp, this is the lingual cusp, and between these two cusps, here is the globular structure. Now this can occur bilaterally or unilaterally. That means right and left on both the sides or on either of the side it can occur. And it has rarely been found on molars, cuspid and incisors. But most cases are of premolars. Now what is dens evaginatus also known as? It is also known as occlusal tuberculated premolar or Leong's premolar, Leong, Leong's premolar, or evaginated odontome or occlusal enamel pearl. Now, this condition was seen in persons of Mongoloid ancestry. That means the Chinese, Japanese, Filipinos, Eskimos. In these people, this condition was prevalent. Now, what is the pathogenesis of dens evaginatus? First thing, it is the antithesis of dens invaginatus. So, in dens invaginatus, what was occurring? There was an invagination. So, it is the complete antithesis or it is the complete opposite of dens invaginatus. So, what is dens evaginatus? It is an accessory cusp or a globule on the enamel on the occlusal surface between the buccal and the lingual cusps of premolars. So our last developmental disturbance is the supernumerary roots. What are supernumerary roots? They are the extra number of roots which can be present in a tooth. Suppose a tooth has normally only one root. So if 2 or 3 or more roots are present in that particular tooth, then that is supernumerary roots. Now it can affect any teeth, incisors, cuspids, bicuspids, molars. It can affect any teeth. But they have a predilection for third molars. It is said that molars, and particularly the third molars, exhibit one or more supernumerary roots. Now let's look at this diagram. This diagram is of mandibular first molar. Mandibular first molar generally have two roots. Normal is two roots. But in this diagram you can see that there is an extra root present, and this root is the supernumerary root. Now, what is the significance of supernumerary roots? It has found its significance in endodontics and exodontia. Now, how? Suppose we do not know about this tooth. We know in mandibular first molar there are only 2 roots, but if by mistake third root is also present, then the obturation will not be done for that particular root. So it will remain unrecognized and it can cause infection. Second, how it can affect during exodontia. Suppose we know that mandibular first molar has 2 roots. We have taken out the tooth and we have seen 2 roots are there. So we will feel that no root has been broken off, but it had a supernumerary root and which is left unrecognized in the socket, and that will cause further infection. So during endodontic procedures, root is unobturated. During exodontia, it can be broken off and they can cause infection. So these are the 10 developmental disturbances that affect the shape of the teeth: gemination, fusion, concrescence, dilaceration, talon cusp, dens invaginatus, dens evaginatus, enamel pearl, taurodontism, and supernumerary roots.